I knew about it, but I think I misunderstood it, as most people I'm finding do. Um, I when we started to shift our focus of cure to comfort with Sam, I started to express that at every appointment and to whoever I came in contact with. And I think I was at like a routine neurology appointment for Sam, and I was expressing these things to him, and he had kind of a dumbfounded look on his face. He didn't know what to do with that information. And also in the room at the time was a neurosurgery nurse practitioner who was refilling Sam's baclofen pump. And we just kind of doubled up on the appointment, and she happened to be in the room. And the neurologist left the room. He was done, and she stayed in there, and she said, "I heard what you said." And she said, "I think you need to see palliative care." And I said, "Okay, I don't really know what that means." And she said, "I don't think you know how to ask for it, but that's what you're asking for." And she said, "I'd be happy to make a referral for you." And I said, "Well, isn't that like hospice?" And I said, "Sam's not like actively dying. What are they going to possibly do for us?" And she said, no, that's not what it means. I think you just need to go see them and hear what they have to say, and they can listen to you." And so that was the first time somebody suggested palliative care to us. And then I did have the appointment with a lovely palliative care doctor. And I remember walking in, and she said, Sam was with me, and she said, "Okay," she said, "I read the whole file." That was shocking. First of all, she read, the file was, and I thought, wow, okay, this is going to be good. And she said, "I want you to tell me the story from the beginning." And I was like, "How long do you have?" And honestly, I think I was in there for 2 hours, which is unheard of for a clinic appointment. And she heard it all. She heard it all from the beginning and up to where we were at that point. And she said, "Okay, what can we do for him today? What can we do to make him more comfortable today? Whether that's tweaking medications or whatever that was going to look like, we weren't sure yet." And so it came into our lives at a very crucial time. I was looking for that, but I didn't know what it was called. I didn't know, how do I get there? I think I actually said to the doctor in that appointment, I said, "Are you sure Sam's really a candidate for this? He doesn't have cancer." That is the stigma that it has. And she said, "No, he's absolutely the perfect candidate for this." She said, "Brenda, he has had life-limiting, things happen to him, and so she said, yes, he is definitely a candidate for us to help you." And from that point on, they really were by our side with tough decisions that came down the road. They said, we can be in every appointment with specialists if you want us there. And so I didn't utilize that right away, but in the last few years, I had them at every single appointment, listening to everything everybody was saying. And they were like an advocate in the room for me when I didn't know what to say. And they would say, they would look at me and they would say, is this what you want? Because this is what, if you decide to do this, this is what it will mean. And it was like, okay, it was just that person to kind of further explain the scenarios, I guess. And having that support was so crucial. And I emailed with them. We just, I don't think I could have provided Sam with the end of his life that I did without their help. It wouldn't have happened that way. There's no way.